Awesome. So now we're so honored to get a lot of your questions answered by an amazing dentist, Dr. Bruce Beard, who's actually my dentist when I'm home. Dad, let's bring
There he is.
we know so many people have been, asking us questions about when they can get back to their routine care. And, being a dentist is part of that. It's something that we all need. So let's just dive right in. Bruce, is it safe to go to the dentist? Is it safe to get routine care or just urgent care? And what should patients really be asking their dentist?
Okay, all great questions. We feel it is safe to come into the dental office. It's one of those things that what has happened is we've been set up to be safe for our staff, our team, and therefore for our patients. We've always exceeded the CDC guidelines in our office, especially since we had the AIDS, we had SARS, different times that we've added different protocols. So the point is, now we just stepped it up even a little bit further, and we can talk about that in a moment. But we do think it's safe to come in. For sure, you don't want to have any emergency treatments put off.
Awesome. And so what modifications have you made within your practice?
Okay, so knowing that you might ask this question, I prepared a little list of all the items that we have put into play to basically make a difference. Like when you arrive at the office, you no longer come into the waiting room because we want to have social distancing. You've got waiting in your car, and then you have texting with our office. That your car becomes your waiting room. Then you come up to the door. Then you have a set of questions that you will have either answered electronically or you will get masked at the door. We take temperatures, and then you immediately get escorted to the treatment room. So there's no waiting around. That's one thing. You've got, like I said, the mainstream traffic is lowered so that you have the distancing. We removed all the magazines and items that can transfer if you happen to be in the reception room as a caregiver. You have, when you come into the room, you're going to immediately be rinsing your mouth with hydrogen peroxide to clear out any bacteria in the mouth, and then hand sanitizer or washing your hands. I can keep going. You can tell me what.
No, it sounds obvious that you guys are definitely taking precautions. And I guess, that's the side of the patient, but what about the side of the staff? Are you wearing protective equipment? Do you change it out in between patients? How has your staff been through all of this?
Okay, this is great. I don't know if I can share on this side because I do have some pictures, but just basically what has happened, we've always worn protective equipment. However, now added to our normal goggles and smocks, we've now added face shields. We have protocols for changing our smocks in between rooms. If it's an aerosol type procedure, we eliminate that PPE, protective personal equipment, or we have other types of smocks that we go in for examinations.
Right. Awesome. And so, if you can touch on that, and then I guess I'll get back to more mainstream questions. There are a lot of questions regarding aerosols and spatter. And, that's a big thing that you use at the dentist. So is there any concern with lingering, aerosols or components in the air that could potentially harm either the
Okay, this is one of the very big areas that we're discussing in dentistry right now is how are those aerosols handled? What are we doing in the rooms? How long can we leave them sit before we can clean a room? Good question. So at the moment, in hygiene, dental hygiene, we are not using the ultrasonic scalers or the circular prophy cups, the ones that polish your teeth. We still polish, but not with the circular automatic instrument, because there is a belief that the virus is carried in these aerosols, and then it would lead to a much longer time for disinfection in between patients. The this has become a big issue, like in our dental offices or in our dental operatories when we're doing fillings or crowns, then we have to have a certain amount of time, usually 15 minutes to 30 minutes in between patients before we can then even scrub down the room.
Wow. Okay. So, I mean, you've obviously made a ton of modifications, but what has been the most challenging modification that you've had to make?
Well, partly is what we were just talking about, the aerosol and the scrub down between the rooms, between the patients, I'm sorry. This is a big challenge because two patients may be seated in two adjacent rooms for two different type procedures, and where we could have an auxiliary in one room and the dentist going in the other room, we really have to slow down the number of patients we see in our treatment rooms. Also, something else that we wouldn't think about before, we always wore masks, but when we would greet someone or we would have to explain a treatment plan, we would have our mask down so you could see our face. A lot of people can't hear you through the mask clearly, especially older people or hearing impaired people. So that creates a difficulty. And I can talk to you about the way we've worked with that also, how we've overcome that.
Yeah. I mean, please tell us.
Okay, so we have a couple things. We've employed teledentistry into our operatories. We have computer screens above each chair, which we would use for education or x-rays. But now there's a camera that goes to our front office team, and that's how people would have their conversations about treatment explanations or insurance explanations. So they don't have to be talking through a mask. Those people that do need to have a little more personal touch, we have, the acrylic sneeze guards have been installed at all our workstations so that we can be talking back and forth with the patient.
Wow. So you guys are utilizing telehealth then?
Yes. Telehealth has become fantastic for dentistry, really great, because very often we're having post-operative consultations or someone is asking a question about implants or Invisalign or something that does not require us to necessarily do a detailed examination in the mouth.
Wow.
So I can have a conversation with the patient via teledentistry, save the appointment time from them coming in, or I should say, save the chair time from them coming in, allowing another patient to come into that operatory.
Wow.
So we don't have to wait for that scrub down time.
Wow.
Like,
that's amazing. So I guess I just have two more questions for you, and then
sure.
I'd like to go. All these changes that you've had to make during the whole COVID pandemic, do you see these as just being temporary during coronavirus, or do you think that things will kind of just go back to normal?
I believe this has become a new norm. Just like I mentioned before, when the AIDS became a very big thing with dentistry in particular, or I should say I became aware of it for how it affected dentistry in particular. We made dramatic changes, which have stayed with us. That became the norm, protected against, hepatitis and tuberculosis, all the items that we should have been aware of previously. But what ended up happening, it became the norm. So anyways, now with the coronavirus, I believe these protocols that we've put in place are basically the new norm. We're not going to be seeing much change. When patients ask, are you going to do this for just till the fall? There's no way that we're going to stop doing this before January, I'm sure. And like I said, like teledentistry, temperatures on people walking in, enhanced disinfection procedures. We have HEPA filters in every room. These just become part of our normal routine.
Right. And I mean, Bruce, the last thing I wanted to ask you is you've let us know that it's okay to actually share with everyone that you had coronavirus. You were actually, one of my dad's patients, and Dad, if we can loop you in for a second,
I'm in.
we just brought up hydroxychloroquine again, and I believe, Bruce, that was one of the medications you took.
Yes. Well, what happened, I got sick on a Tuesday night, and I knew that something was going on. And by Wednesday or Thursday, when it was not clearing up, of course, we contacted every patient who had been in for the previous 14 days or 16 days, I think it was, just to let them know there had been an exposure. And then got better. And then when your dad gave me a call and said, "Yep, you tested positive," then we really stepped it up. And I was doing pretty well, not thinking much about it. I was able to be treated at home. And then towards the end of the week, something occurred, and I started to feel something occurring at the top of the left side of my chest. And I felt like my breathing was a little bit more labored than I had ever experienced. Went to the ER. Sure enough, I had contracted pneumonia, probably an aspiration pneumonia. And they said when they looked at the CT of the lungs that I had the COVID in the lungs. Anyways, Sam and I had talked about it before, and there wasn't enough research, and it was sort of like up in the air. And he was kind enough. I had asked specifically to have the prescription, and after I was able to get the drug, when I left the ER that day, I started on the antibiotics and I started on the hydroxychloroquine. Whether it made a difference, I don't know.
Wow.
All I know is 3 days later, I was essentially feeling great and back to normal.
Right. And my perspective was that this was back in March, where I really felt that hydroxychloroquine was a very reasonable thing to do. Now in June, I probably wouldn't have given you hydroxychloroquine. I just don't think there's any data supporting, and may in fact be dangerous. Now, we put you on an antibiotic with that, but I didn't give you azithromycin because we knew at that point the combination was probably toxic. I think we used cephalosporin or Augmentin or something like that. I think it was probably Augmentin.
I think it was Augmentin, yes.
Right, because that doesn't change EKGs. So I wouldn't do that now. And since you have had about 14 other patients that have done very well and have not gotten hydroxychloroquine. So we've got to be, like there's a guy I think in New York that gives all of his patients hydroxychloroquine, but we don't know how they would have done without it. So anecdotal reporting is never of the same level as research.
Right.
I'm glad you did well. Otherwise we wouldn't have a family dentist.
Right. My sense of the medications, I'm sure the Augmentin did the majority of the work. That's what my sense is. The hydroxychloroquine, I think at the time you had prescribed what was the norm at 3 times a day. I took it twice a day. And the moment I started to feel better, rather than taking an entire 8 or 10 day regime, I took myself off of it. I was fortunate not to have any side effects. And frankly, in speaking with patients, I'm much more confident to say that I know that in our office, we're doing all the protocols and that these protocols do make a difference. And yes, people can get it easily. But I do think, going back to our first question, I do believe it's safe to go to the dentist as long as the proper protocols are followed.
Right. And we were talking a little bit before, it might even be medically necessary. We know that if a patient has gingivitis, it elevates their C-reactive protein, which is an inflammatory marker. We know that marker, if your marker is high, it increases the risk of a bad outcome from COVID. So you may be doing yourself a benefit by reducing gingivitis and getting your teeth cleaned. Would you agree, Bruce?
Yes, I 100% agree. And I would say that it's a definite that you would do that. One of the problems that we experienced is at the beginning, the governor was saying that dentistry was a non-essential service. And this, if you look at like our practice motto is healthy mouth, healthy body, healthy life. Yeah. If you have a low-grade infection in your mouth, like Sam was saying, gingivitis or periodontal disease or abscess, that creates an inflammatory burden on the whole body that can basically take away those soldiers from treating COVID or take away those soldiers from treating other diseases in the body. I'd like to share. This week, I had a young patient in their early 20s, but very, very bad periodontal disease. The gums were very inflamed. Obviously, had not been educated to this, but had been told about their treatment 6 or 8 months ago and chose not to do it for whatever their personal reason was. And as I was talking to them, I said, this increases your chance for getting infected with anything because you're fighting this infection. She says, you mean I can get corona? I said, I'm not saying you're going to get corona, but you're increasing your chances for that dramatically by this low-grade infection, putting a burden on the body. So immediately she wanted to start up her treatment.
Wow. Well, Dr. Beard, thank you so much for coming on today. It was so nice to see you.
Great to see you.
I miss you so much, but also, I think it's so important for people to understand that, going to the dentist and getting your mouth cleaned and taking care of your oral hygiene really can prevent so many issues in the rest of your body. And I think it's something that people forget. So thank you so much.
I think you're doing a great service by helping people to understand this. And Dr. Fink's program has been spectacular. I have most of my patients washing weekly, which has been very helpful. It helps me from having to answer the questions.